Hello everyone, welcome to Nelson Pharmacology. We are Group 12 and today we will exploring insulin medication. Actually, insulin is a naturally occurring hormone in our pancreas and is essential for allowing our body to use glucose for energy. But if our pancreas doesn't make insulin enough or our body doesn't use properly, it leads to the high glucose level in the bloodstream and over time it becomes diabetes. At that point, the body cannot manage blood sugar on its own, so this is the time insulin medication becomes necessary. Now, let's take a closer look at what insulin medication is. Insulin may be synthetic or animal-derived, and to have glucose enter the body cell, especially when the body's own insulin is no longer enough. By having glucose into the cell and keeping blood glucose level. So, insulin is much more than just a medication. It's a life-saving treatment. Insulin therapy plays a vital role in treating glucose balance, preventing long-term complications, remain an essential part of the diabetes management for millions of people, millions of diabetes patients in the world. For drug classification, we have 5 types of insulin based on the onset of action and duration of effect. And the first we have brand name we call Novorapid, and is it generic name insulin aspart, and is it rapid acting insulin type. And we have Atrapid is a brand name, and it is regular insulin in the generic name, and this is short acting insulin. And we have Humula N, is it NPA insulin, is intermediate acting. And we have brand name Lantus, and is it insulin glargine in generic name, and is it long-acting insulin. At last, we have Tricipar, is it in the brand name, but we also call it insulin glutaz, is it generic name, and is it ultra long-acting insulin.
We use insulin in the management of 3 types of diabetes complication like diabetes ketoacidosis, DKA, and also use in management of hyperkalemia, high blood potassium. So first, diabetes. Diabetes is a chronic condition in which the body cannot properly use or produce insulin which have glucose for energy. As a result, blood sugar level rises and can lead to serious health problems. We have 3 types of diabetes. Type 1 diabetes is the pancreas cannot produce insulin to maintain blood glucose level, and it is genetic abnormality. And we also have type 2 diabetes. This condition is even the pancreas produces insulin, but the cell has resistance of using glucose in the blood. And the third one is gestational diabetes. This condition is pregnant women have high glucose level and is related to pregnancy hormones. Next, insulin is used in diabetes emergency called diabetes ketoacidosis or DKA. In this case, insulin helps lower very high blood sugars and stop the production of ketones. Lastly, insulin can also be used for hyperkalemia, which means high potassium in the blood. Insulin helps move potassium into the cell and bring the level down. So, these are the main situations where insulin is needed. Next is the contraindication of insulin. This means the condition where insulin should not be given. The first is hypoglycemia or low blood sugar. If the blood sugar is already low, giving insulin can make it worse and be very dangerous. So, it's important to always check the patient's blood glucose before giving insulin. The second contraindication is if the patient has a known allergy or hypersensitivity to insulin or any ingredient in the insulin product. Although allergic reactions are rare, they can happen. So we must check both blood sugar level and allergy history before giving insulin. And then the most common side effect is hypoglycemia or low blood sugar. It can happen if the insulin dose is too high, if the patient skips meals or after having exercise. And then symptoms of hypoglycemia include sweating, shakiness, dizziness, fast heartbeat, hunger, blurred vision, and in severe cases like fainting. So that's why it's very important to teach patients how to recognize these signs and treat them quickly with sugars or juice. Another side effect is lipodystrophy. This happens when insulin is injected in the same spot again and again. There are two types, lipoatrophy and lipohypertrophy. Lipoatrophy, when fat tissue breakdowns, causing a death in the skin. And then the next one is lipohypertrophy, when fat builds up, forming a lump under the skin. To prevent this, patients should retain their injection site regularly. Lastly, insulin may cause allergic reaction. Mild reaction may include redness, swelling, or itching at the injection site. Rarely, serious allergic reactions may occur, such as rash, breathing difficulty, swelling of the face or throat, or a sudden drop in blood pressure, which is called anaphylactic reaction and need emergency care.
Explain the pharmacodynamic of insulin. First, insulin works by binding the receptor on the surface of cell membranes, especially in muscle and fat tissue. This binding allows glucose to enter the cell, reducing blood sugar levels. Second, insulin acts on the liver and muscle to promote glycogenesis, which means converting glucose into glycogen for storage. Again, this helps to lower glucose in the blood. Third, insulin stimulates lipogenesis, that is, the formation of fat in the liver and adipose tissue. It also promotes protein synthesis in muscle, which is important for growth and repair. Finally, insulin plays a role in electrolyte balance by activating sodium and potassium transport. It shifts potassium into cell, which decreases the level of potassium in the bloodstream. In summary, insulin helps lower blood sugar, supports storage of energy, promotes protein and fat production, and regulates potassium level. Now I explain the pharmacokinetics of insulin. First, absorption. Insulin is mainly given subcutaneously using a syringe or insulin pen. Only short-acting insulin can be suitable for intravenous injection, especially in emergencies. Next, distribution. After injection, insulin circulates in the plasma and extracellular fluid, and then binds the receptor on target cells such as the liver, muscle, and fat tissue. For metabolism, insulin is broken down by insulin-degrading enzymes, mostly in the liver and kidney. Last, excretion. The inactive metabolites are removed by the kidneys in patients with kidney problems. Insulin can stay longer in the body and may have a prolonged action. The x-axis shows time hours after injection. The y-axis shows insulin levels in the blood. In this picture, the blue line is rapid-acting insulin like Lispro or aspirin. It starts quickly and peaks in 1 to 2 hours. The red line is regular insulin, starts in about 30 minutes, peaks around 2 to 3 hours, and lasts 6 to 8 hours. The green line shows intermediate insulin like NPH. It starts in 1 to 2 hours and lasts around 12 until 18 hours. The orange line is long-acting insulin like Glargine. It has no peak and works steadily for 24 hours. In short, each type has different onset, peak, and duration, depending on how it is used to manage blood sugar. Here, you can see a cross-section of in the skin. The injection goes into the fat layer located just beneath the skin but above the muscle. Now, you can see the recommended areas on the body where insulin can be injected because they have a thicker layer of fat. The upper outer arms, the abdomen, especially around the belly, the upper of the thigh, and the upper buttocks or lower back area. Now I will explain about the dosage of insulin. First, let's look at the standard concentration. Most insulin used today is U200, which means there are 100 units of insulin in 1 milliliter. On a U100 syringe, each mole equals 1 unit, so we can measure doses accurately. Next is the dosage by diabetes state. For type 1, insulin is required every day. The dose is often calculated based on body weight and food intake, usually 0.5 to 1.0 units per kilogram per day. For type 2 diabetes, insulin may be added when lifestyle changes and oral medication are not enough. The starting dose is usually 10 to 20 units per day, or 0.1 to 0.2 units per kilogram. Now I will explain this table, which shows the generic names of different types of insulin, their dosage formula, and their recommended time of administration. First, we have insulin aspirate insulin of Lispro, which are rapid-acting insulin. The dose is usually 1 unit per 12 to 15 grams of carbohydrates, and they are given 15 minutes before meals. Next, the regular insulin, which is short-acting, the dose is 0.1 units per kilogram, and it should be injected about 30 minutes before meals. Then we have NPH insulin and intermediate acting insulin. The dose range from 0.2 to 0.5 units per kilogram per day, usually given twice daily in the morning and evening. Next, insulin glargine is a long-acting insulin. The dose is 0.2 units per kilogram or sometimes just 10 units and is given once daily at the same time of the day. Lastly, insulin degludec is another long-acting insulin. The dose ranges from 0.2 to 0.4 units per kilogram and is also taken once daily, but the timing can be flexible as long as it's consistent. In summary, the choice of insulin type, dose, and timing depends on the patient condition, lifestyle, and how their blood sugar is.
Nursing consideration, baseline assessment, a basic examination to determine the patient's initial condition before treatment begins. Then we have to assess the symptoms of hypoglycemia, the signs of low blood sugar. We must assess the current weight and recent weight loss. That could be a sign of metabolic problem or diabetes. We have polyphagia and polyphuria, excessive appetite, and frequent urinate. Blood glucose, a test to find out how high or low the blood sugar level is currently. Then we must assess hemoglobin A1C, a blood test to see the average blood sugar level over the past 2 until 3 months. That helps to determine whether the patient's blood sugar is well controlled. We have renal hepatic function assessment too, a test to see if the kidneys and liver are working well. Then we have urinalysis, a urine test to check of sugar, protein, or other substance that could indicate complication of diabetes. Then we have lab tests, that a test that check the potassium and magnesium. And in the nursing consideration, we also have storage guidelines. For unopened insulin, we put in the fridge at 2 degrees Celsius until 8 degrees Celsius. And for opened insulin, we put at the room temperature for up to 28 days. We put clear label with open date and expiry date in insulin and store separately from other meds with clear labeling of high alert medication. And then the independent double check, we have 2 nurses check 5 types of medication independently and make the commentation. The cultural of religion sensitivity, adjust insulin during religious fast like Ramadan or Hindu fasting. We as a nurse purify the insulin, pork or beef verified, and then we offer the alternative based on beliefs. Some see insulin as a last resort. As a nurse, we must to address fears with empathy. Patient education is important in the nursing care. That's why we must explain how insulin will help maintain blood glucose level with normal range, and should adhere to individualization regimen, which is frequent glucose monitoring, regular activity, and reduce carbohydrate and increase fiber diet intake. Not just that, but we must explain how to recognize and manage symptoms of hypoglycemia, that like hunger, fatigue, tremors, headache, dizziness, and confusion.
When we use the insulin, we have to follow pregnancy safety intent. Most insulin types are FDA category B, meaning they are safe for our pregnancy mother and also the fetus. And insulin is the first line treatment for gestational diabetes and pre-existing diabetes because it does not have the precedent. However, insulin glargine is category C and it should be used only if benefit outweigh risk. When we use the insulin, we have to avoid special precautions like check blood glucose level before administration. We have to follow the story guideline and do double check and have the sign and symptom of hypoglycemia before and after administration. When we use insulin, we have to avoid special population like pregnant women, pediatric patient, elderly patient, and a patient who have renal or liver impairment. And we also have to avoid drug interaction because alcohol may increase the risk of hypoglycemia, and medication like beta blocker, clonidine, and risperidone may make some of the signs and symptoms of hypoglycemia.